Health officials said a North Carolina man tested negative for Ebola. He returned to the United States from Liberia on Friday and developed a fever. Meanwhile, a new report found that Ebola is spreading up to 9 times faster in parts of Sierra Leone than it did just 2 months ago. As the virus runs rampant in West Africa, the global community is searching for ways to contain the spread. 2 former heads of NATO are urging the alliance to join the fight. They say that NATO has a unique set of capabilities that could stem this spread of Ebola. And in a case that's testing the limits of state legal authority over quarantines, Maine and Casey Hickox finally reached a settlement on Monday. Hickox is a nurse who treated Ebola victims in West Africa. We turn now to Arise News correspondent Shahan Ramkissoon with more on the latest.
Well, Debbie, there finally is an agreement reached between the nurse being monitored for Ebola and the state of Maine. Casey Hickox will be allowed to travel freely in public, despite officials initially demanding she stay indoors. And as you know, she treated Ebola patients in West Africa and has clashed with U.S. authorities since her return last month. First, she was put in a makeshift isolation tent in New Jersey. Then she was told not to leave her home in Maine, just in case she contracted Ebola in West Africa. But Nurse Casey Hickox was defiant, going on bike rides, causing some alarm in the Fort Kent neighborhood. To her, though, she's no threat, especially not after testing negative for the virus twice.
It is not my intention to put anyone at risk in this community.
Today, a court ruled in her favor, saying she can go out. The one condition, she must constantly monitor herself until November 10th. Meanwhile, Dallas nurse Nina Pham, who recovered from Ebola, has finally been reunited with her dog, Bentley.
He made our life, he made our job so easy. Bentley is amazing. He worked with us every step of the way. He was a joy just an absolute joy to work with, Nina.
Oh, look at him, really cute there, Bentley, all cuddly and running around freely. Well, he was in quarantine for 3 weeks and was being monitored for Ebola because he was in close contact with Pham after she showed symptoms of the virus. Debbie?
All right, Shahan, thank you very much. Well, Dr. Jamie Wells is a professor at New York University School of Medicine and the author of the book called Ebola, The Making of an Epidemic. And she joins us here in our New York studios to talk more about how it's being handled. Welcome to Arise America.
Thank you so much.
It's so good to see you. You know, there's been a lot of confusion, a lot of criticism about how the United States has handled the incidence of Ebola, because it's not an outbreak in the U.S., but the incidence of Ebola here in the U.S., and the divergence between how the federal guidelines from the CDC and how individual states, have chosen to address this. Will you sort of give me your assessment of how we've handled it overall, and should there be one uniform protocol?
I think, honestly, this is all distraction from what really the fundamental problem is. We are West Africa. West Africa is us. This is a problem since 1976. In 1976, when the first outbreak of Ebola happened, it happened in a world away to those people. It's this persistent ethnocentrism, this myopic view that what's happening a world away has no relevance necessarily till it comes here. So in 1976, when Ebola broke out, there was nothing on the news here about it. Swine flu was the fear and panic of the time. The government spent $135 million on the swine flu epidemic that never came to be. In fact, it was actually a debacle. And quietly, disease cowboys were fighting Ebola a world away. That's why I wanted to write my paper, because the same story happens again and again. It happened with Ebola in 1995 when it broke out again. It wasn't until the threat could possibly be here. And that's the fundamental basic disease of why this whole policy is a Band-Aid on a ruptured artery. We're playing catch up every time there is an outbreak, because in the interim periods, something is quashed, funding ceases, people go about their business or distracted by other things, then another outbreak happens again. And until it can fundamentally happen here, that's when everybody pays attention. The first death of Ebola happened in December of 2013, this time. Why is it that it's now that we're
It really has taken for Ebola literally to come to the U.S. for not only for the media to give it attention, but also for funding to follow it. Because the truth is, Dr. Wells, wouldn't there be at least a vaccine, if not perhaps even a cure, if this had happened on U.S. soil 30 years ago? Well,
what happened in 1976 is that you had the outbreak that was quashed. The swine flu epidemic didn't come to fruition. You had in 1977, smallpox was eradicated. So there was a period of time called the health transition, where a lot of funding on emerging infections went away. And you have these brilliant scientists trying to heed the call that we can't, let all this go in terms of our interest in emerging infections, but that was the current philosophy at the time. And not until, again, in 1995, when Richard Preston released in the early 90s his book, The Hot Zone, which was a fictionalized version of what actually happened in Reston, Virginia, where there was a monkey Ebola-like strain in the US, where it was this whole, what if it could happen here? And coincidentally, there was an outbreak at that time as well in Africa.
Let me pivot a little bit and talk about quarantine. There's been a lot of confusion, particularly because healthcare workers who have treated patients in West Africa have come back. We know those first 2 cases with Kent Brantley and Nancy Wright Bull, and then the healthcare workers here that contracted it from Thomas Eric Duncan. And now this case with Casey Hickox and her defying this mandatory self-quarantine. Is it important for healthcare workers? First of all, it is important for them to go and help. But when they come back, is it important for there to be a mandatory 21-day quarantine no matter what, even if they're not showing symptoms?
I think that the CDC's guidelines are tried and true and tested. They follow along with the World Health Organization. It depends on what country you're coming from. They're doing quarantines in advance of that. It depends on what your risk factor is. But I find a lot of people trying to get their 15 minutes in the world is distracting, and again, diverting resources away from where things are needed desperately. You're having children in Africa who are now permanently orphaned by this situation. The crisis there is tremendous, and people here need to recognize that we have a shrinking global village, and not just in the United States, but globally. This is a global problem, not just a West Africa problem or a United States problem.
What you and I know, particularly with an outbreak, it really does have sort of a bell curve, if you will. Where are we in this outbreak?
I think money will stop this outbreak ultimately, and it's not going to happen overnight. Funding practices need to change, but I have a colleague friend of mine who's a surgeon went to Sierra Leone in the last decade, and they didn't have an autoclave in their hospital system. An autoclave is requisite to make sure that surgical materials are properly sterilized. There are fundamental problems when you have civil unrest in countries for decades at a time. I think in Liberia, I read something that there were 44 physicians for 1.4 million people, something like that, because during this period of time, healthcare workers died or took a mass exodus. So until you solve those, put in basic public health infrastructures in these places, things are not going to change. We'll just keep band-aiding the issue.
It only makes sense if only someone would listen. Dr. Jamie Wales, thank you so much.
Thank you.
Appreciate it. And you're watching Arise America. That's great.